who is one of our specialist nurses, and she's going to talk to you about her role. I can find your slide show. It's just hidden the icon. Does that want to move now?
Hi there everybody, nice to see some faces that I know, and welcome to everybody from the region and further afield. My name's Alison Chatten. I'm a myeloid nurse specialist in Leeds, so I care for people with both acute leukemia and chronic myeloid leukemia. A little bit about my background. This is Hattie Jakes, if anybody's too young to remember Hattie Jakes. So I probably qualified when Hattie Jakes was on the TV. But I've worked in haematology for 13 years now, but prior to that I did work on the bone marrow transplant unit for a couple of years in the 1980s. I am that old. I'm a nurse prescriber, so I've done the nurse prescribing course, so I can see patients in clinic that are on these kind of drugs and prescribe accordingly. Occasionally, if your clinic appointment doesn't run in time with your medication supply, patients sometimes ring me up and say, can I have an interim 2-week prescription? And that's fine, providing they come to clinic in 2 weeks' time to get some more. I'm also a clinical assessor, so I do examine patients in my other clinics. So that's me. So the role of the leukemia nurse specialist. We take a key role in coordinating patients' care. We provide a point of contact when patients need help, advice or information. We act as a link to the teams involved in your care as well. So we basically, at the point of your care, anything you ask us, we can signpost, any queries you have, any understanding of your care, any understanding of your drugs, any side effect problems, you can ring us. We also have an emergency contact number, which is important. So if you're feeling breathless in the night and you're under Satinib, you can ring the 24-hour helpline and people will know what to do. So what can you expect from your key worker, CNS? We're asked to call it key worker, and that's part of the cancer peer review measures. So at time of diagnosis, we should meet all the patients diagnosed with CML. However, it's a very busy clinic, and often we miss, so we have to catch up with them at a later point, but that's very rare. We assist in the help and advice you require. I might not be able to manage all of your problems, really, because that's probably beyond my control. But what I can do is signpost you to financial people, Macmillan, financial benefits, help advice, psychology service in the hospital. However, the psychology service in the hospital does have a 12-week wait for routine appointments. Not ideal. However, Leukemia Care, and there's Leukemia Care in the audience today, do have a fund whereby anybody that's struggling with the feelings at time of diagnosis or throughout their journey with CML can apply to Leukemia Care for up to £400 for 6 counselling sessions. Either Leukemia Care will find you a counsellor in your area, or you can find your own counsellor. You just have to apply online and then they'll sort it out for you. Work issues as well. We were just talking earlier in the coffee break about when you first start on your TKI treatment, it's probably a good idea to maybe, if you can do financially, have a couple of months off work just to get settled into your drug and get used to taking it. Obviously, you may drop your blood count, so you may not be able to go to work if you're feeling tired or prone to infection if your white cell counts go. So we usually recommend you have a couple of months off just to settle into the drug. I can point you to counselling services in Leeds. We do have the Robert Ogden Macmillan Centre, whereby we have counsellors there, but again, the waiting list for that is about 6 weeks. So ring us if you're feeling unwell in Leeds, ring us, and we will refer you straight away, and then your wait won't be that long. And I've said about the emergency contact details. So at time of diagnosis, then, we're asked to complete a holistic needs assessment. I don't know how many people have heard of holistic needs assessment, but generally it's meeting the patient and finding out about them as a whole. So we are interested in your CML, but we're interested in you as a whole, your family, any family issues. We focus on emotional, spiritual and social things and practical problems that you may have, dealing with your employers, providing letters of advice, and various things like that. So this should be completed at the beginning and the end of treatment, or on recurrence if you off drug and then you have to go back on drug. So that's me in a nutshell, really. So at the lunchtime break, if anybody wants to come and talk to me and chat over anything, just a show of hands, has everybody got a clinical nurse specialist in their area? Yeah? Yeah, most people. Who hasn't? Yeah. Who hasn't? Okay.
Two haven't, three haven't.
Right. Oh,
Go on, put your hands up.
come on, who hasn't?
Go
Wave.
right to your hospitals
One,
and
two.
complain.
So 5, yeah, you should have support from somebody like that in your area, really, as Jane says. So push your hospital or ask your consultant, where is my clinical nurse specialist? Because that's not actually fulfilling cancer peer review measures. Okay. Come and see me at lunchtime. Thank you. Thank you.